Now we are going to discuss about the ulnar nerve. Ulnar nerve. This is the ulnar nerve. It arises in the axilla from the medial cord. This is from the medial cord. Its root value are C7, C8 and T1. Now let's discuss about the course and relations of the ulnar nerve. In axilla, it lies medial to the third part of the axillary artery. Later enters the arm as a main neuromuscular bundle. It pierces the medial intermuscular septum to enter the posterior compartment of the arm and goes to the medial epicondyle, and there it is lodged in a groove which is known as cuboidal tunnel. The cuboidal fossa, it is in between the medial epicondyle and olecranon process of the humerus. Later, it enters forearm by piercing the two heads of the flexor carpi ulnaris. This is the flexor carpi ulnaris. Later, ulnar nerve passes through the flexor retinaculum superficial to the flexor retinaculum, which is covered by the ulnar carpal ligament. Later, the ulnar nerve is terminated by dividing into superficial and deep branch. Deep branch supplies the hypothenar muscles and ends by supplying the adductor pollicis. See, this is the adductor pollicis where the ulnar nerve ends by supplying to this muscle. Perhaps deep branch enters the Guyon's canal, which is also known as Pissohamet tunnel. It is purely motor, supplies all the intrinsic muscles of the hand except the muscles of thenar eminence and first two lumbricals. Okay, now let's discuss about the branches of the ulnar nerve. In forearm, it gives muscular branch. In forearm, it divides into muscular branch which supplies to the flexor carpi ulnaris and medial half of the flexor digitorum profundus, and superficial branch which gives muscular branch which supplies the palmaris brevis muscle and lateral side of the little finger. Lateral branch gives common palmar digital nerve. Later, the deep branch which gives muscular branch which supplies the hypothenar muscles, supplies the medial two lumbricals, adductor pollicis, and also to the deep head of the flexor profundus. Sorry, it's not flexor profundus, it's flexor pollicis brevis, and articular branches supplies wrist joint. Later, now let's discuss about the clinical anatomy of the ulnar nerve. It is known as the magician nerve as it controls the fine movements of the fingers, commonly injured in the elbow, at the medial epicondyle, at the wrist in front of the flexor retinaculum. At elbow causes paralysis of the medial half of the flexor digitorum profundus. Ulnar nerve lesion at the wrist produces the ulnar claw hand. Symptoms of the ulnar claw hand are hyperextension of the metacarpophalangeal joint and flexion at the interphalangeal joint. This is the ulnar claw hand, and following symptoms also occur in the ulnar claw hand like vasomotor changes, tropic changes and sensory loss to some extent.